days just feel heavy. You might be going through all the motions, getting things done, but deep down, something just feels off. It's this feeling that's so hard to put your finger on, but it is so, so real. So today, let's talk about it. Let's explore what that feeling might be and what the path back to clarity can actually look like.
How about this? Does this question kind of hit home for you? It's that feeling of being disconnected, like you're walking through a haze you just can't name. And look, this is way more than just a bad day. Really understanding it, well, that's the first step.
All right, so let's dive right in and break down what that unexplained fog actually feels like. And I want to be clear, these feelings are not failures, they're not signs of weakness, they are very real experiences that honestly so many people share.
This is one of the biggest ones. Sometimes it's called anhedonia. It's when things that used to light you up, a hobby, hanging out with friends, even your favorite song, suddenly feel flat. It's almost like the color has just been drained from everything.
And right along with that loss of joy often comes this fading motivation. It's so important to get this. This is not about being lazy. It's a genuine shift in that internal engine that powers you through your day, through your work, and even through your basic routine. And here's where it all kind of piles up. When joy feels a million miles away and your motivation is gone, even the simplest tasks can feel like you're trying to climb a mountain. Answering an email, getting dressed, all of it just carries this incredibly heavy, draining weight. But here's the thing, it's really important to understand that these feelings, this fog we're talking about, they can actually be mapped to a set of recognized signs. And that's a good thing. It gives us a language to describe what's going on, and more than anything, it confirms you are not the only one feeling this way. So take a look at this list. Maybe you see yourself in one of these, or maybe several. It could be that real struggle just to get out of bed, or that feeling of being emotionally numb, disconnected, or hey, maybe you've just noticed you're avoiding your friends lately. Seeing these written down can be so validating. It's proof that what you're feeling is real and that other people experience it too. And this really shows us that depression isn't just one single thing. It's more like a spectrum. For instance, major depressive disorder, or MDD, usually involves really intense symptoms, while dysthymia is more of a lower grade but much longer lasting depression. Others are tied to specific things, like seasonal affective disorder, SAD. Figuring out the specific type is really the foundation for getting the right kind of help. Okay, so if any of this is resonating with you, the next logical question is, what do you actually do about it? And that brings us to our next step, demystifying what it really means to reach out for help. This is often the biggest hurdle. The fear of the unknown can be totally paralyzing. What are they going to ask me? Are they going to judge me? It's a step that definitely takes courage, but I promise you, it's far less scary than you might think. Honestly, the process is way more straightforward than you might imagine. It all starts with an initial evaluation, which is really just a conversation about what you've been feeling and your history. From there, a professional develops a personalized plan because your experience is completely unique to you. And crucially, this includes ongoing support, so you're never just left on your own. And that personalization part, it is absolutely essential. There are no one-size-fits-all solutions when we're talking about mental well-being, so the approach has to be tailored specifically to you. A modern treatment plan really takes a holistic view. Think of it as a combination of different tools. This might include medication, sure, but also targeted psychotherapy, like CBT, which helps you actually reframe negative thought patterns. It can even involve things like screenings for nutritional factors and, building lifestyle routines that create a real sense of stability. And the great news is the toolkit is always expanding. Standard approaches, things like therapy and medication, are incredibly effective for so many people. But for some of the tougher cases, there are advanced options out there, like TMS, which uses these targeted magnetic pulses to stimulate nerve cells in the brain that are involved in mood. The point is, there is always another path to explore. Which brings us to the ultimate goal of this entire journey, right? It's not just about managing symptoms, but about truly reclaiming your sense of self and your clarity. I think this quote just captures the spirit of recovery perfectly. It's not about trying to erase sadness. It's about building a solid foundation of stability, rediscovering that sense of purpose, and maybe most importantly, learning how to be compassionate with yourself through the entire process. And it is so important to remember this. Recovery takes time. Some people feel a shift in a few weeks, while for others, it takes months of consistent care.
Progress isn't always a straight line, and that is completely okay. Every single step forward, no matter how small it feels, is a victory.
So we'll end on this question. This isn't about having all the answers right now. Not at all. It's just about considering, what might that very first small step be? Maybe it's talking to someone you trust. Maybe it's just doing a little more research. Or maybe, just maybe, it's making that first phone call. Whatever it is for you, that single step is the beginning of the path out of the fog.